The WeRPN Violence Prevention Toolkit, Module 8, Responding to Dementia, developed by WeRPN with the support of the Government of Ontario. In this module, we will look at the care needs approach of patients who live with dementia and/or are experiencing delirium. We will look at dementia, risk factors, tips for communication, delirium, delirium risk factors, responsive behaviors, and tips and resources. What is dementia? Dementia is a general term used to describe the decline in cognitive function, which typically includes cognitive impairment, memory loss, difficulty with problem solving, language, and in some cases, mood or behavior changes. There are 3 stages of dementia: mild, moderate, or severe. They may also be referred to as early, middle, or late or advanced stages. There are many diseases which can cause dementia, with Alzheimer's being the most common. 3% of people living with dementia are under the age of 65. Understanding dementia is critical in avoiding or preventing violent incidents. Nurses should be aware of the signs and symptoms of dementia and have strategies available to manage responsive behaviors. There are 3 stages of dementia. Persons living with mild or early stage dementia are able to do most things functionally and carry out day-to-day tasks, for example, making simple meals. However, driving a car may be too complex for them to process. At this stage, persons may still have some awareness about their limitations. Typically, there are no responsive behaviors. Persons living with moderate dementia may require more assistance with activities of daily living, medication management, and going to appointments such as medical appointments. Persons with moderate dementia may be more indecisive and require help in decision making. At this stage, there may be some changes in a person's behavior. Nurses should be aware of and watch for symptoms of anxiety, depression, or even hallucinations. Depending on the type of dementia, psychiatric symptoms may appear in this stage. For persons living with advanced or severe or late stage dementia, cognitive and physical functions, mood, and behaviors may all be affected. Therefore, total care for this person is often required. Changes in behavior are common and may include hallucinations, use of profanity, hitting, or punching. Dementia is a progressive condition. A nurse's ability to communicate with a patient experiencing a decline in cognitive function is important. Some useful tips are: approach the person from the front, identify yourself and your role, maintain eye contact, address the person by name, present one idea at a time, repeat or rephrase the person's response, ask yes or no questions, use gestures, listen actively. Let the person know if you are going to touch them. Delirium, as defined by McMaster University's Optimal Aging, is a sudden, confused state of mind. It's not a disease itself, but a change in a person's attention, awareness, and thinking. The signs of delirium include trouble paying attention, periodic confusion, becoming restless or upset, having trouble staying awake and sleeping more, seeing or hearing things that aren't there. Delirium is very common in older adults with an occurrence rate of 29 to 64% in hospital. Some risk factors for delirium include, but are not limited to, persons who are older, age 65 or older, infection, recent surgery, have had delirium before, extensive medical problems, memory troubles, taking more than 5 medications, poor hearing and/or poor vision, or dehydration. Delirium may be misdiagnosed as dementia. Follow your organization's guidelines to ensure your patient is being screened correctly. Delirium can be prevented and treated. Responsive behaviors have meaning. These are often the result of a patient not being able to express their needs or wants. Some examples of responsive behaviors include, but are not limited to, hitting, grabbing onto people, pushing, throwing things, biting, scratching, spitting, hurting themselves or others, kicking, pacing, wandering, trying to get to a different place, performing repetitious mannerisms, general restlessness, screaming, cursing, repetitive sentences or questions. An example of this would be a patient who won't eat and cannot verbally express that they are in pain, and as a result, they spit out their food and start to scream. Strategies to reduce violence when caring for patients with dementia. Developing an individualized care plan when caring for patients with dementia can be an important step in identifying triggers, ensuring a consistent approach to avoid triggers, and reducing violence related to dementia. Sharing the care plan with all members of the healthcare team and family supports a person centered approach to care. At minimum, the care plan should include the preferred name. How does the person like to be addressed? The known triggers, those activities or events that have been identified as causing violent outbursts, and strategies that can be used by family and care providers to avoid the triggers. For example, a person known to be triggered by too much activity in the morning, you could schedule more of the ADLs in the afternoon or evening. In the community, this could mean scheduling a visit later in the day as opposed to first thing in the morning. The care plan should be a living document that can be updated as needed. Developing and using emotional intelligence is also an important skill when caring for patients with dementia, as it may help nurses to manage conflict more effectively and strengthen relationships. Having self awareness, self control, and the ability to respond in an appropriate way to someone's emotions gives you the insight. Knowing when to provide space or offer support and using emotional intelligence to moderate emotions can result in more successful management of highly charged situations. Helpful resources that provide information and education to nurses and other healthcare providers in caring for patients with dementia include the Alzheimer's Society Ontario, a not for profit organization that is the province's leading care and research charity focused on providing support related to Alzheimer's and other dementia diseases. The resources and education are available for both families and healthcare providers to assist in caring for patients with dementia. The gentle persuasion approach, also known as GPA, provides effective techniques to use when caring for people with dementia. This approach provides the care provider with education on dementia care with a focus on who the person is and how the brain is impacted by the disease. It also provides education on communication techniques and strategies to reduce injury to the person with dementia as well as the care provider. You can learn more about this approach on the Public Services Health and Safety Association PSHSA website, and there is a healthcare web tutorial available. This completes Module 8 of the WeRPN Workplace Violence Prevention Toolkit. Please continue to Module 9.